civilian world don't understand the weight you bear. When you're drowning in the silence and nobody's there, there's a voice that cuts through static, someone who's been through the fire.
Hi, I'm Cole Warner, CEO and President of Baldwin-Friesenmeyer and Master Sergeant in the Army Reserves, and you are here today with Your Battles Rally Point. My guest host is Sheila.
Hi, I'm Sheila Schneider, proud military spouse and the Executive Director of the Kauffman Fund. And today, we're being joined by a friend of the Kauffman Fund, and that is Laura Russell-Ricci. Laura, thanks for joining us today.
Sure. Thank you. Thanks for having me.
Not a problem. Laura, let's start it off. I'm very lucky to know you, but kind of tell us who you are, what's your background, a little bit about you.
Sure. I'm with the Department of Veterans Affairs Suicide Prevention Program. I've been with the program 3 years, the VA 12. I am a licensed clinical social worker and a veteran of the Army. I am a mom to 3 kids. Husband he and I have been married 24 years now, so that's a little snippet about me.
Lots of hats that you're wearing there.
So, Laura, I know that you have guidelines to follow, so what we want to do is stick to that in regards to, so tell us a little bit about your organization and your mission inside the VA.
So the Veterans Health Administration has a mission statement that tends to be on everything that the VA has, and it's to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, caregivers, and survivors. So the St. Louis healthcare system, we take a public health approach to suicide prevention. And the local suicide prevention program provides education, outreach to community partners, in addition to direct clinical care and collaboration with a veterans established treatment team.
The VA is huge. Some of us are learning more and more about it every day. So what's the most important thing that you want people to know about your program?
Yeah, well, veterans are at a higher risk for suicide compared to the general public. Veterans are quick to help others, but they may struggle to help themselves. And if you or a veteran needs support, I say don't wait, reach out. Veterans, family members, friends can look up on the internet va.gov/reach for resources for veterans and their supporters. Now, if a veteran is experiencing an emotional crisis, they should call the Veterans Crisis Line at 988 press 1. And they can receive immediate support.
Okay. So, what specific services beyond the crisis line do you guys offer to veterans in the clinical health category or mental health category, I guess?
Yeah. So our local suicide prevention coordinators work in collaboration with a veterans established treatment team, and they collaboratively work with a veteran to enhance their care to reduce risk and aid the veteran's recovery and goals. Additionally, our suicide prevention coordinators provide a training called VA Save. That training goes to community partners, and the VA Save is a free 1-hour educational presentation with a learning objective of understanding the scope of veteran suicide within the United States, knowing how to identify a veteran at risk for suicide, and knowing what to do when a veteran is identified at risk. Community engagement partner coordinators like myself help invest in partners in identifying opportunities to support veterans, creating coalition efforts around key suicide prevention public health strategies. Efforts like this help to ensure all veterans have effective network of support, communication, and care across the communities in which they live and work in every day.
Now, I've actually attended that a couple of times now, and that 1-hour training really is helpful just to be able to have insight into your program and different ways that as community partners that we can help out. And I want to say thank you for always agreeing to do that training for us whenever we do a mental health workshop or conference or that type of thing. I appreciate that.
Yeah, thanks for the opportunity.
It's all about the partnerships.
Absolutely.
What do you think is the most impactful part of your program?
Well, the VA provides an invaluable health and mental health care for veterans, which is crucial in reducing veteran suicide. For mental health services, the VA offers a continuum of care to meet the needs of each patient. Many veterans start their mental health care in the same office where they see their primary care doctor. Sessions with primary care mental health integration providers are easy to coordinate with primary care appointments. These mental health providers provide brief services to help address mild to moderate depression, anxiety, substance use, and other concerns affecting veterans' health. Our mental health outpatient clinics offer a team-based approach to mental health care and serve as a one-stop shop for mental health needs, including psychotherapy and medication management. For veterans in need of specialized outpatient mental health care, we offer specialty programs focused on treatment for PTSD, substance use, and serious mental illness. Additionally, we provide mental health and substance use residential programs and inpatient mental health care.
Yes.
So now, I mean, granted, with the VA and all veterans are available to reach out for help when needed in these programs. What I would like to know is how do you measure your success in your program?
Yeah, so first of all, we serve all veterans. And I want you to know that veterans not enrolled in VHA care can call or visit the patient registration at either the local medical campuses, Jefferson Barracks or John Cochran, during visiting hours. So they should bring their ID and their DD-214. They can also call, this is great, the 1222-8387 to enroll. Veterans who need immediate care should call 911 or go to the nearest emergency room. And John Cochran has an emergency room that veterans can utilize. It's also important to note that any service member or veteran can call the Veterans Crisis Line, and registration with a VHA is not required. If you're interested in registering with the local VHA after you call, they refer you to the local facility's suicide prevention program, who will help the next business day. But to answer your question, VHA individualizes all veterans' care to meet their unique needs. And a veteran's input is key to successful recovery. After we collaboratively identify goals, then we create a treatment plan utilizing evidence-based practices to help them meet that goal. For community engagement partners, the work that I do, our VA leaders identify new goals each year to help us expand our reach, work towards maximization of suicide prevention efforts. And I'd like to say everyone has a role to play.
And it does take all of us. I mean, it really does.
Well, in the VA SAVE program and stuff that Sheila's taking the classes with you, in the reserves, we have Master Resilience trainers and the Master Resilience course, which, to be honest, I think every single soldier, service member, sailor, individually should take that class.
Yes,
absolutely.
Not just the continuing education requirement, but I mean just the trainer class for what you can get out of it. So, and I'm not saying I have not taken the SAVE class, but I'm guessing some of the fundamentals are the same in regards to recognition of patterns and things like that, and how to break an iceberg when you need to.
Yep.
But I want to skip down on some of the questions. And how can a veteran get in touch if they need immediate assistance?
Well, definitely 988 is press 1 is the number one way if somebody is in crisis or struggling. And then they can call the number or they can chat with veterancrisisline.net or text, and I've done text before, which is 838-255. And then also by going to the emergency room.
Repeat the text number, because I've found a lot of veterans are okay to text.
Yeah,
they
absolutely.
Don't want to do anything else, but they will text. So give us that text number one more time.
Yeah, it's 838-25.
Yeah.
I did kind of run through it a little bit quick.
It's okay. It's okay. Yeah, because I mean, and it's showing that the VA is trying to meet the veteran where they're at, right? Some will call, some want to just go on and do the chat. Some get frustrated with the chat bots, until they get connected. Having the text piece is really helpful. It's something that I hope will go on to other programs as well, to where people can do that texting to reach out as well.
I hope so too.
Yeah. So what about your non-emergency or non-urgent?
Well, veterans can contact their primary care team, as they have embedded mental health staff, the primary care mental health integration provider. They can help assess needs, refer to appropriate ongoing care. All veterans are welcome to call our mental health clinic directly, and so I have another number for you. To make an appointment is 5090.
So they would call and make an appointment. What if somebody wanted to walk in? Are there walk-in hours?
So if a veteran needs emergent care, they should call 911 or the nearest hospital without delay. But veterans who are not already connected with mental health care and have a primary care team, I would say make an appointment with them and use same-day access services or walk in for non-emergent needs. The integrated mental health staff can help with other needs.
Okay.
Veterans who wish to be seen via outpatient mental health clinics or need same-day access for non-emergent mental health services can call or walk in. Mental health clinics are located both at John Cochran and Jefferson Barracks.
So they submit, they get the appointment or try to get the appointment. What is the expected turnaround time in response of between the request to standard appointment?
That, I would say our Veterans Crisis Line, and I don't mean to keep going back to that, but it's really a fundamental part of what I'm talking about today is, they'll give immediate support. They'll help them safety plan. They can send a referral to the local suicide prevention coordinators for further assistance in care and or resources. And if the veteran accepts, then the suicide prevention coordinator will call them the next business day and offer more support and help.
What do you think are some of the biggest challenges facing veterans currently right now?
I'm actually really glad you asked that.
Because there's a lot, or at least on my side, there's a lot.
Oh, there is. I think the biggest challenge for them is knowing what resources are available to them. Yeah. There's an initiative that most veterans, family, and friends don't know about that can help a suicidal veteran with access to emergent services, and it's called the Compact Act. So I want to talk about that just a little bit.
Yes, let's do it.
Yeah, so the Compact Act was a law passed by Congress in 2020, and it states VA will provide, pay for, and reimburse for emergent suicide care for eligible veterans at VA medical facilities and at non-department facilities. So the intention of the Compact Act is to ensure that veterans are not financially responsible for the cost of either inpatient or outpatient care that is associated with their suicidal crisis. So this specifically covers up to 30 days of either inpatient mental health stabilization or a residential program, up to 90 days of outpatient care related to mental health crisis, the cost of medications associated with the mental health crisis, and the cost of the initial emergency transportation that took the veteran to the hospital related to the crisis. Meaning the ambulance ride to the hospital does not cover transportation. It does not cover transportation costs associated with follow-up appointments. So you get the ride to the emergency room, but for follow-up appointments, there's no transportation. So the benefit of the Compact Act is that it expands eligibility coverage to individuals who are not typically qualified for VA care, which is important to note. Additional benefit is that veterans who are able to choose where they want to receive care to address their suicidal crisis, either within the VA or outside provider. In order to qualify for Compact Act benefits, an individual must experience an acute suicidal crisis event. This is defined as an individual determined to be in imminent risk of self-harm by a trained crisis responder of healthcare. So I think this is something that veterans need to know more about, the family members, anybody that deals with veterans. the Compact Act is very important to care.
To be honest, I didn't know about it. Did you?
Well,
you had the class.
I've had the class. And mental health is one of the programs for the Kauffman Fund, so it's fun that Laura makes sure that we're updated on all of this. But Laura, what do you say to that veteran who's hesitant? I mean, yes, there's these resources. Yes, there's the Compact Act to help them, but what do you say to those who are hesitant to reach out for help?
Well, I mean, there's still stigma and sometimes fear around seeking mental health services, including like suicide prevention help. However, it's important to know that you're not alone and seeking help is brave. Also, veterans who are trained to put mission or others before themselves, which could make it harder for them to accept or ask for help for themselves. And really, veterans, it's important to take, again, bravery to reach out for support when you need it. If you're struggling, don't wait, reach out. Okay, I can't stress that enough. You know, we're here to serve you. I mean, Kauffman Fund, the VA, we're here to serve. So
That's true. That's true.
So if someone listening wants to help the VA or help coordinate and get in contact, what is the best way for them to help contribute to our veterans and or the VA's crisis line? Is there volunteer ways? Is there anything they can do outside of just referrals?
Well, I mean, there's definitely the VA Save, which is a good training for people, family, friends, companies, you know, and you can reach the suicide prevention coordinators for non-urgent, like signing up for the Save. Mm-hmm. And that's another number I'm going to share. So this isn't for crisis or anything like that, but this is to sign up to get a VA Save. That number is 314-894-6166. And so we're here Monday through Friday, 8 a.m. to 4:30 p.m. And additionally, if somebody wants to take the training for themselves individually, they can go online to Psych Armor and complete the training there. And I won't give you the full, because it's pretty long, but
I'll put it into the
notes. But you can certainly, my first experience with VA Save was through Psych Armor. So It's the same training.
Well, and so when we do this, what we're going to try to do is we'll encapsulate all the phone numbers you listed today.
Okay.
And put that in the bottom of our credits. So when we go through. Now, I think there's only a couple things last to reference in that.
Yeah.
So is there anything important that we haven't covered that you want to make sure that people are aware that the VA supports and helps? I mean, I think the crisis line and information and contact in regards to the VA Save program are terrific. We want to make sure that we've encapsulated everything to really show what you guys do for us.
Yeah, so, you know, I don't want to be a horse dead or anything like that. You know, we've talked about calling 911. We've talked about 988 press 1. We've talked all about that. The one thing I also do want to stress to veterans, you know, at the hospital, a veteran should identify themselves as being a veteran, so outside hospital can get in contact with the VHA. Community care office in order to have their care covered. So a veteran or someone on their behalf may report the emergency care to the VA. And so here's another number. It's a very important number because it has to be called within 2 hours of the visit.
You said 2, right?
72
within 2 hours?
Yeah.
72. Okay.
72. It's 1-844-24-7842, and you want to report the care episode. And again, you know, like I said, the crisis line, you can call that for really anything outside of a crisis, because a crisis is a crisis for somebody. So, you know, people should just call. I mean, we get all kinds of calls, so definitely call 988 press 1.
Yes.
Well, Laura, I want to immensely thank you and we appreciate everything that the VA does, and they support our veterans. I'm not a veteran yet because I'm still serving. At least that's what the VA tells me. But here in the next year or two, I'll officially be done with the military.
And we'll make sure it gets registered on time.
Yeah, you've got the number.
Yes,
we've got the connections.
So I'm just working on paperwork, I guess, at this point. But thank you, and this is Your Battles Rally Point. Our goal is to help educate our veterans on the different organizations out there and how they help us, and make our lives better tomorrow. So. Again, thank you.
Laura, I appreciate you so much, and I hope I've said this to you personally a few times. I appreciate what you're doing for the veterans, supporting the community, those of us who are also trying to help out, and your position, you are so valuable to the overall population. So thank you, thank you, thank you, thank you, thank you. And then, as Cole said, to our listeners, if you're fighting your own battles or know a veteran who could benefit from the VA suicide prevention, you can find all the contact information and resources we discussed in our show notes. And Laura, thank you for being with us.
Thank you for having me.
Thank you. And then last but not least, until next time, this is Your Battles Rally Point. This is Cole Warner.
And Sheila Schneider. Stay strong, stay connected, and remember, there's always a rally point.